Where, and we're going to stay in Glasgow, the World Health Organization is launching a health and climate change survey report later this morning, looking at the progress on climate and health by 91 countries. One of those who is at COP26 to encourage decision makers to focus on health is Dr. Jeni Miller, the Executive Director of the Global Climate and Health Alliance. The Alliance advocates on behalf of many climate change groups and works with the WHO on global health policy. Dr. Miller joins us on the line now from Glasgow. Welcome to the programme. Just take us through, if you can, some of the ways in which climate change affects health.
Yeah, James, sure. Thanks very much. We're really seeing this roll out in real time in the last couple of years, especially. It's quite ramped up. Just this year, we saw a deadly heat wave in Western Canada, of all places, kill hundreds of people. In Australia, we had, and many other countries, we've seen out of control extreme wildfires that expose people to wildfire smoke for extended periods of time, drive them from their homes, and of course, in some cases, directly injure or kill them. In many countries, significantly in Southeast Asia, we've seen extreme flooding, but that's not the only place we're seeing flooding. And again, people are driven from their homes. Often hospitals and clinics are flooded as well. So the very places that people would turn to for care when they need it are also being impacted by these climate effects.
My sense is that politicians often think of these things in terms of events rather than perhaps things that will have long-term consequences, in some cases, on people's health.
Well, when we're talking about things that displace people, the consequences of that can be very long lasting. There are people I'm from California, where extreme fires are now an annual occurrence. There are people that were impacted by fires 2 years ago that are still not back in their homes. There's trauma associated with that. There's also just the practicalities of how do you care for yourself, how do you care for your family when you're displaced in that way. When we're talking about smoke exposure, people who have respiratory issues, women who are pregnant and are breathing wildfire smoke when their child is in utero, there's emerging evidence that wildfire smoke can damage the growing fetus. So we're not talking about just short-term impacts. We're talking also about longer-term impacts as well.
So when you talk to politicians, what's the case that you're making? What should they be thinking about?
Yeah, well, we really feel that health and equity as well should be really at the heart of the climate policy making. And it's not just because of the impacts of climate change on health. Health has a good story to tell as well. If we make the changes that we need to make in order to address climate change, we can see significant health benefits in addition to whatever protection of health from averted climate change. So, for example, if we stop burning fossil fuels, we'll see significant improvements in air quality. Currently, air pollution kills millions of people around the world per year. Reducing air pollution would, avert those deaths. If we move to healthier food systems that are more sustainable, this will make sure that people have access to healthier foods. And there's significant potential for health benefits there. So all of those health benefits in turn can bring health cost savings. So really, it's a very positive story we have to tell. If you take these actions, particularly if you do it with health explicitly in mind, you can get health benefits that bring health cost savings. And that's good news for governments.
Yeah, imagine that's a message they might well be willing to listen to. That's Dr. Jeni Miller, Executive Director of the Global Climate and Health Alliance.